Hey, it's Tom Jordan. You know, you can't get more COVID-19 inner circle than my guest today, Dr. Robert Redfield. He is the director of the Centers for Disease Control and Prevention. The CDC is on the program. And I'm asking him directly about President Trump's handling of the pandemic. What does he think as one of the world's leading experts in this field? All that and more in this edition of Tom Jordan's Got Issues.
You thought you had issues?
You've been shot at in a train wreck?
I love my country.
Wait until you hear this.
I required that as a requirement.
1600 Pennsylvania Avenue.
Yeah.
She calls you a liar.
This is, I gotta shake it up.
I can't lie about facts.
Tom Jordan?
Great to be with you, Tom.
You don't strike me as someone who's clutching your pearls.
Major issues there.
I don't have pearls.
Tom Jordan's Got Issues.
Yep, sure do. And so does my guest today, the director of the CDC. You know, you really can't get much more on the front lines of the COVID-19 battle than Dr. Robert Redfield. He is one of the main players in the White House Coronavirus Task Force. His decisions, you know, like the CDC coronavirus guidelines, influence decision makers not just in this country, but all across the world. We are going to discuss with him a number of issues today. His concern about the fall, the autumn, and how what we do now could impact the spread of COVID-19. Is it really safe to go back to school? Should family members be allowed to visit their dying loved ones in the hospital, you know, dying from things other than COVID-19, things like cancer? A lot of people right now in this country are dying alone, spending their final days without their families, without their spouses, without their kids by their side. And the kids and the spouses don't like it either. They want to be with them. And what does he think about President Trump's handling of the pandemic from the perspective of one of the world's leading medical specialists? A lot of answers from one of the world's most insiders of the COVID-19 pandemic. Dr. Redfield, thank you for joining us.
Thank you, Tom. Glad to be here.
It's good to have you. So we're looking at the latest that we have, U.S. numbers. It's somewhere about more than 6 million cases in the United States. About 186,000 people have died. You have said in the past that you are concerned about the fall, what might be coming our way, heading into Labor Day weekend now, people gathering together. How much depends, do you think, on this weekend in terms of how seriously people take the CDC precautions, wearing masks, social distancing, those kinds of things, on the impact on the potential spread of the coronavirus this fall?
This is a really important weekend, as we saw, unfortunately, with the Memorial Day week, which really seeded a large spike throughout the South. We saw, again, another significant seeding event at the 4th of July. Right now, we are in progress across the country. The numbers are coming down. We had a peak of almost 67,000 cases in a day. Now our average has dropped persistently down each day, each week. We're down now probably on an average in the high 30s. Same with our deaths that peaked at 2,500. They're now under 1,000, coming down. We want to maintain that trajectory of control. So this weekend's really important that people really do remain vigilant about wearing masks, social distancing, washing their hands, being smart about their family gatherings, keeping them small, making sure that they distance and wear masks during those events. This is extremely important. The second area that I encourage people to discuss over the Labor Day weekend is how important it is this season for each of them to get the flu vaccine. Obviously, with flu coming and COVID coming, if we could get everyone vaccinated and maintain our mitigation steps, that really does look like we're having the lowest summer flu activity that we've ever had. But we really got to keep it up. It's something we're going to need to do vigilantly until we really get a vaccine deployed. So this is an important weekend. We're putting out some special announcements at CDC to try to just reinforce and encourage people to say, you know, this is the weekend to get it right, to follow this mitigation guidance, to go all in, so that we can really hit September, October, the COVID going down as we begin to also have to confront flu.
You know, we're concerned about these spikes, and in Michigan at least, and maybe other states as well, some of the largest spikes of COVID-19 are in nursing homes. And here we've had 32% of the deaths are from these long-term facilities. Our governor, Gretchen Whitmer, she's come under fire for her allowance of these COVID patients being treated inside long-term care facilities. How do you think this maybe could have been handled better? Or maybe what can we do from here on out?
Yeah, I like the second part better. I know there's going to be plenty of time for postmortems, about everything that we could have learned to do better, because we're learning on the run here. Clearly, nursing homes are a key area of high vulnerability. It turns out that only 0.1% of the American population lives in a nursing home. But nursing homes account for more than 40% of the deaths, between 40 and 50% of all deaths in this country. So clearly, this is where we're paying the big price in terms of loss of life. This week, CMS has come out with additional regulations that nursing home employees get screened based on the prevalence of infection in the area. So most nursing homes will be screened twice a week or once a week, and some in the lower prevalence area once a month. The key for nursing homes has been the employees, which have unfortunately brought the virus in to the nursing home. This week also, and last week, and hopefully by the middle of September, CDC and the U.S. government will have provided portable point-of-care testing machines to every nursing home that has a CLIA waiver. That's 14,400 of the more than 15,000 nursing homes will have their own ability to do their screening of their employees, and I hope will then offer opportunity to target screening visitors. I think a lot of people fail to understand the huge cost to the health of nursing home citizen residents that's really been paid by not having the ability to interact with their loved ones.
Yeah.
So, nursing homes continue to be something we all have to be vigilant about. And unfortunately, you're right. Across the country, we've seen now more cases back again in nursing homes. I think it's just important for people to realize, like schools, the cases in nursing homes aren't starting in the nursing homes. They're actually being brought in from the community. And in this case, they're brought in usually by the healthcare workers. And this is one of the reasons now CMS is going to require by regulation that these healthcare workers actually get tested on a regular basis to see if we can pick up asymptomatic infection and prevent these nursing home infections.
You brought up a very good point. We're talking about nursing homes here, but also in hospitals. I have a dear friend of mine who is watching a friend who was just a young friend, just diagnosed with stage 4 cancer. His wife is not allowed to go in and visit him, and he is dying alone in a hospital with his family not able to see him. Isn't there a more humane way that we can deal with this importance of the social interaction, especially for a family who may be on the verge of losing a very important loved one?
Yeah, Tom, this is there's so many collateral tragedies associated with this pandemic, and this is one. I mean, my brother lost a very, very close friend in the same situation where they were not able to have any contact other than on a telephone to a close friend who was dying, and you're never going to get to go back and do a rerun. Different hospitals are handling it different ways. I do think there are ways to do this safely, to allow these critical interactions, but it's important that people actually view them as important interactions. I do believe the human connectedness, and I do think, we are going to unfortunately show that the health and deterioration of nursing home residents has substantially deteriorated as a consequence of the lack of this human connectedness. And I think it's important that we work to try to prioritize it, realizing we want to be safe and sensible, but we need to try to prioritize it as as I think for the well-being of many people is important as whatever medicine they're getting in their IV.
I got two quick questions for you. In your professional opinion, as the director of the Centers for Disease Control and Prevention, how do you think the President, Donald Trump, has handled this pandemic to this point?
Well, I think the President's been extremely decisive. I mean, I happen to be part of the original. I think a lot of people, when they look back, we had our first case recognized in this nation in January 21st, 22nd in the state of Washington. And by January 31st, the President shut down all air travel to China. Extremely decisive action. And then, of course, in March, all air travel to Europe. These were not easy decisions. They had enormous economic consequences. I believe by standing up the task force with the Vice President and those of us on it, myself, Ambassador Birx, Dr. Fauci, Dr. Hahn, Surgeon General Jerome, Admiral Giroir, we've got a lot of strong minds that are here, contrary to the critics. And I always like the Teddy Roosevelt quote, never mind the critic, the credit goes to the man, and I paraphrase, or woman. It's in the arena, all bloodied and marred and tarred, and tries, comes up short, fails, comes up short. But at the end of the day, we have the triumph of knowing high achievement, or if we fail at least by daring greatly. So I think that's the team. We're working hard. The key, as you know, has been the governors and the state and local territorial tribal health departments. We're all in this together. You can never prove what didn't happen, but I can tell you that the original documents that crossed my desk in late February, early March, projected that over 1 to 2.4 million Americans will die from COVID prior to October 1st, 2020. It was a very sobering day. And I think we've all committed ourselves to do everything we can to confront that. And while it's sad and tragic, I've lost one of my children, 6 children. No one wants to see, not from COVID, but no one, death is a tough thing. 186,000 people, it's a lot of people. But I will tell you, in the absence of really some of the decisive actions that was taken by the President, I think the most important aspect we're going to see in the future is this Operation Warp Speed, and really putting the mission down that was to get a vaccine available before January 2021. It wasn't, hey, let's try to do everything we can, let's bring in more industry. No, it was, we need a vaccine by January 2021, and we have probably one of the most effective private-public partnerships that I've ever witnessed. I've been in this space my whole life, vaccine development. We now have 3 vaccines already in phase 3 trials. We're already purchasing and producing those vaccines at a volume of 100 million doses per vaccine, with the assumptions that they might work so that we don't have to wait once these trials are over. So I think it's extremely probable, no one can guarantee, that we're going to have one or more vaccines available for the American public later this fall, which I think is unprecedented, and I will tell you is a direct consequence of the President's leadership.
Wow. Okay, Dr. Redfield, thank you. I got one final question. I'll let you go here. We've had some outbreaks at some of our college campuses here, Central Michigan University, Grand Valley State University here in the state of Michigan. Do you think, what should colleges do here? Should we have in-person learning, or should we have online learning, maybe a mix of both? What's your professional perspective on that?
I'm a big advocate, and particularly let's go to the K through 12s. I think it's critical to their own public health that they get back to in-face learning. I think we can do it safe and sensibly. Higher learning, again, I think it's all is better served by getting back to in-face learning. The key in the higher learning is I need the students to have discipline. When we're looking at what's driving these university and college outbreaks, it's the decision that the students are making to have mass gathering parties and interactions. This is not helpful. This is what causes these clusters to occur. So I know a lot of universities are really starting to enforce that they're serious about their mitigation responsibilities of each of the students. But I do think my appealing to the students is to really embrace these mitigation steps of mass social distancing, washing your hands, and being smart about crowds. Obviously, I want them to get the flu vaccine too. And I really do believe if everybody did that, really, we would have these outbreaks under control in 4, 6, 8, 10, 12 weeks, and we could get back to, they could get back to seeing Michigan play Michigan State, But until we get everybody on board to realize that they have a critical role in this war against this COVID virus, and that role may seem very simple, very nondescript, but wearing a mask, social distancing, hand washing, smart about crowds, don't get into big crowds, don't be going to crowded bars, and I think if we do this, we'll get it started. So I do think they should. I will say another thing. I think it's very important that as these schools do see these cases, we're asking the presidents and the college leadership, the worst thing that they could do for us this Labor Day weekend is send those students home. I'd much rather see those students stay in the facilities. Many universities have developed special dormitories for isolation for individuals that have active COVID. Those universities that are suggesting that they go online and send them all home, that's really another national seeding event that we don't need right now.
Yeah.
And so that's what I would encourage, is to get those students, keep them on campus, move towards in-class learning, but really engage and appeal to their greater angels of really adhering to these mitigation steps as part of their own social contract with the university and their classmates.
Yeah, Dr. Birx would agree with you on that for sure. Dr. Robert Redfield with the CDC, the director of the CDC, thank you so much for joining us. Real pleasure. And I'm sorry for your loss as well.
Thanks. God bless.
Thank you so much.
I would love your thoughts. You can find me on Twitter at Tom Jordan News, or go to the WWJ Facebook page. You can go there as well. You can find me on Facebook also. And don't forget to listen to WWJ News Radio 950 every weekday morning with Roberto Jacina and me, the entire morning crew, as well, also on radio.com from 5 a.m. to 10 a.m. Eastern. Again, that's WWJ News Radio 950. Also find us live stream on radio.com. I'm Tom Jordan, and I've got issues.